The majority of people, young and old, have been taking different cough and cold non-prescription syrup to get high. Dextromethorphan, well known as DXM, is the generic name for cough medicine. Basila Kandanga is a mother of 4 and lives in the central part of Katutura in Philip Turime Street. Kandanga said the producers of this highly intoxicated and addictive purple drink use young people who themselves are hooked on the drink to sell it at school premises and its surroundings.
We as parents are living in fear for our children's lives because we are seeing them taking it often, but for them they don't see or feel anything as they are like sleepwalking, and for us it's a concern.
Kandanga says something needs to be done because some of these children drop out of school and their lives are destroyed by this addiction. NBC spoke to a pharmacist at the Catholic Hospital, Benjamin Kumalo, who says he came across many cases of people who are addicted to this drink, purple drink. The cases he came across involved youth between the ages of 15 and 18 and some adults.
We take cough syrups and mix it with things like soda or whatever drink. Obviously that is just to improve the taste of the medicine. Some people just drink it that way. Some would even go to an extent of soaking marijuana in the syrup.
Kumalo says parents should start educating their children about the dangers of this drink, and they must also get worried when cough syrup starts disappearing from the fridge or cupboards.
The two commonly abused ones are dextromethorphan, which in short is DMX, and that's what it's called in the street also. And the next one would be your codeine, promethazine containing cough syrups. These are because these two drugs are what you call psychoactive, which means they have an effect on your mind, on how you think, on how you see things. So people abuse them for that reason.
He says most cough syrups can be lethal when abused. Symptoms of the purple drink are slurred speech, droppy eyes, slow heart rate, drowsiness, loss of balance, paleness, constipation, urinary tract infection, dental problems, and when combined with alcohol and other drugs can lead to death. We spoke to a clinical psychologist, Dr. Sean Whitaker, who says this addiction is very common among the youth and parents tend to underestimate how dangerous it can be to their children.
In fact, it is estimated that about 10% of teenagers have gotten high on a cough syrup at some point. And of course, it's easy for them to get hold of this cough syrup. Like I said, you go to the store, you buy it, it's legal, it's accessible, it's inexpensive.
Dr. Whitaker says education, awareness campaign, psychological therapy, and rehabilitation are needed to stop the abuse of cough syrup and also to reduce the addiction.
It only takes one sip for you to get addicted. But remember, you are the key to your own future. For NBC News, Stash Mbundu, Windhoek.